Bloomberg slams RFK Jr. Crackpot science endangers America. Michael Bloomberg has raised a significant alarm regarding the appointment of Robert F. Kennedy Jr. as the Secretary of Health and Human Services, suggesting that this decision could have dire consequences for public health in America. It's not too late for Senate Republicans to rectify what many consider to be one of their gravest errors this year. Since his confirmation, Kennedy has seemingly unleashed a wave of misinformation that threatens the well-being of countless Americans. If the Republican Party does not take decisive action to hold him accountable, the repercussions could be tragic, leading to unnecessary loss of life and severely damaging the president's reputation in the realm of health and safety. Kennedy, who lacks formal training in medicine or public health, has established himself as a prominent figure in promoting dubious scientific claims and unfounded conspiracy theories. The most alarming aspect of his appointment to the Department of Health and Human Services is the potential for him to erode public trust in vaccines. This erosion of confidence could result in preventable illnesses and fatalities, a reality that is already beginning to unfold. But here's where it gets controversial. Many people may not realize the extent to which misinformation can spread and influence public opinion. The implications of Kennedy's views on vaccines are not just theoretical. They have real-world consequences that can affect the health of entire communities. As we navigate this complex landscape, it's crucial to ask ourselves, how do we balance the right to free speech with the responsibility to protect public health? This situation invites a broader discussion about the role of science in policymaking and the importance of relying on credible expertise. What do you think? Are we doing enough to combat misinformation in health policy? Join the conversation and share your thoughts. Medical groups and states challenge Kennedy's vaccine decisions. But here's where it gets controversial. The U.S. Health Secretary Robert F. Kennedy Jr. has sparked a heated debate over federal vaccine policy, prompting medical groups and states to create their own guidelines for the fall respiratory season. While some argue this is a necessary step to protect vulnerable populations, others warn it could deepen confusion among healthcare providers and patients. Experts caution that the lack of a unified standard may leave healthy children and pregnant women without access to critical preventive shots, especially as vaccine hesitancy persists. This push for alternative recommendations runs against hundreds of state laws that rely on the Advisory Committee on Immunization Practices, ACIP, a federal panel that advises the CDC on vaccine approvals and recommendations. Kennedy's removal of 17 ACIP members, many of whom were anti-vaccine activists, has raised alarms. Since his appointment as head of the Department of Health and Human Services, HHS, under President Donald Trump, Kennedy has dismantled long-standing federal vaccine protocols, citing political motivations. His decision to fire ACIP members and replace them with pro-vaccine advocates has left many questioning the integrity of public health guidance. Leading medical organizations, including the American Academy of Pediatrics, AAP, and the Infectious Diseases Society of America, IDSA, have sued Kennedy over his handling of the pandemic. AAP claims it will develop its own evidence-based guidelines for the fall respiratory season, including COVID-19, influenza, and RSV. We simply cannot and will not stay silent as the system we rely on is being intentionally dismantled, said AAP's president, Dr. Sue Crespi. Meanwhile, the American College of Obstetricians and Gynecologists, ACOG, is working to update guidelines for the upcoming season, emphasizing the continued recommendation of vaccines for pregnant women who face higher risks of severe illness. The Vaccine Integrity Project, a group of public health experts, is collaborating with these organizations to review scientific data. Dr. Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy, emphasized that independent data review is essential to ensure recommendations are based on sound science. However, HHS officials defend Kennedy's actions, arguing that the new panel brings fresh, independent scientific judgment and that ACIP remains the statutory authority for immunization policy. Yet, critics argue that the fragmentation of health policies creates a confusing landscape. Senior analyst Jen Cates of KFF notes that US states had historically maintained a patchwork of rules. And now, with multiple entities issuing recommendations at both federal and state levels, parents may struggle to determine which guidelines to trust. For example, Wisconsin continues to recommend the current COVID vaccine for pregnant women and children aged 6 months and older, while Democratic governors in California, Washington, and Oregon have condemned Kennedy's dismissal of ACIP members, calling it a threat to transparency. Several states are already taking action. Colorado has amended laws to include recommendations from major medical societies alongside ACIP, while Massachusetts lawmakers are considering legislation to override ACIP's recommendations. Maine has removed references to ACIP from its vaccine access law. Osterholm stressed that health insurers are likely to prioritize uniform vaccine guidelines, pushing for greater alignment among groups. We need to come together the best we can, he said, but we can't leave ACIP or HHS recommendations as the only other source out there. The stakes are high, as vaccine hesitancy and policy fragmentation could impact millions. As the US navigates this complex terrain, the balance between public health priorities and individual choice remain a contentious issue.